Dr. Charles Olaro, the Director General of Health Services at the Ministry of Health, has revealed that all national referral hospitals will be equipped with lung units to improve lung health in Uganda. Dr. Olaro told Beg Media while opening the third Makerere University Institute Lung Science and Health Symposium and the celebration of the 10th anniversary of the institute at Makerere University.
Lung conditions like chronic obstructive pulmonary disease, but also asthma. But also you have other outbreaks which come up with lung condition, and you need to recognize that the lung is like the skin, it's exposed to the environment. So any contamination, any particles contamination which you have in the environment, you end up by breathing them into the one. And so now we are seeing people who are coming with the.
Olaro expressed his concern on the rise of respiratory cases leading to pneumonia, asthma, and other respiratory infections attributed to smoking and poor air quality from pollution, and revealed that they will soon lobby government to fast-track the implementation of the anti-tobacco law to penalize public smokers.
Pneumocyosis, which is associated with at the points of at the mining areas, but also we are seeing that most of our communities cook with the biomass. They are also exposed to lung complications because of the smoke which they inhale.
Dr. Olaro commended the Lung Institute for playing a central role in controlling chronic ailments and respiratory infections, expressing government's commitment to expand the capacity of the institute. Professor Jeremiah Chakaya, who was the guest speaker, expressed concern about the high prevalence of asthma and the post-tuberculosis lung disease, noting that close to 300 million people were infected with asthma, posing a big challenge to lung health in Uganda and Africa as a whole.
Based on number of people developing TB, number of people getting treated and what have you, that's a success story. Most countries in Africa are doing well because we are picking up people with TB, treating them successfully. We are also seeing some little change in poverty rates in many African countries, but you know Africa is a bit unfortunate. There are too many countries that have conflicts. And when there are conflicts, then you can't provide the care that you need and stuff like that, and the population.
It disclosed that people living with HIV may stand a higher chances of getting asthma, and the situation had become worse with high poverty levels in Africa, where communities face malnutrition, poor shelter, limited access to medical care, and conflict.
Making people with TB, identifying people with TB, and treating people with TB. That we are doing well. Many African countries are doing well, including my own country in Kenya. We have reached the milestone that was set for 2022 in terms of reducing number of people developing TB. But unfortunately, the rate of decline, the rate at which the TB problem is coming down is too slow. It will take many years before we get there, because the rate of decline of tuberculosis is just too low. Yeah.
Has urged health workers across Uganda to detect and treat pneumonia cases early, warning that delays increase the risk of spreading respiratory infections, especially among children. Dr. Victor Musime, an associate professor and head of the Department of Pediatrics and Child Health at Makerere University College of Health Sciences, made the remarks at the university's third Lung Science and Health Symposium held at the main hall.